This is our PowerPoint on nursing care for the client who is experiencing homelessness. So here's some general information that explains why cultural competence is important. We live in a multicultural society, so this means that hospitals will receive patients from various backgrounds. It is important that the RN is educated on the cultural background of each patient so that comfortable and proper patient care is given. And then down here is the theory of culture, care, diversity, and universality by Madeline Leininger. And essentially, Madeline Leininger started the theory of cultural care, diversity, and universality, which is the origin of cultural competence. The goal of this theory is to provide culturally congruent nursing care. So what is culturally competent care? Culturally competent care is defined as care that is sensitive to issues related to culture, race, gender, and sexual orientation, achieving self-efficacy in communication skills, cultural assessments, and acquisition of knowledge related to health practices of certain cultures. Culturally competent care is an ongoing process that aims to achieve effectiveness or effective care that helps the patient reach optimal health and wellness, all while being culturally aware. So the three attributes to culturally competent care are ability, openness, and flexibility. Ability relates to the RN's ability to resolve disparity between the patient and healthcare professionals. Openness relates to keeping an open mind and providing care with acceptance and respect and maintaining non-judgmental care. And flexibility is important because RNs must be able to adapt to many different situations to provide culturally competent and patient-centered care. No two patients will require the exact same type of care, so it is important to be flexible to each patient and situation in which we are presented. So the four domains to culturally competent care are the cognitive domain, affective domain, behavioral domain, and the environmental domain. And the cognitive domain relates to being aware of each individual patient's culture and learning about the practices of those cultures. The affective domain relates to being sensitive of each patient's culture and being sure to not cross any boundaries that may make the patient feel uncomfortable, disrespected, or disregarded. The behavioral domain relates to performing culturally based physical assessments and even possibly using a translator to properly communicate with a patient that may speak another language than the RN. And this is the practice of using intercultural communication skills. So now the environmental domain relates to any cultural encounter that the nurse may face, whether it is a culture the RN is familiar with or not. It is the job of the nurse to familiarize and educate themselves on the culture of the patient that they are caring for, so that the nurse can provide comfortable, culturally competent care for the patient. And so what are the benefits of cultural competence? So there are receiver-based benefits, which include improvement of quality of life, improved healthcare satisfaction, and adherence to the treatment provided. And there are also provider-based benefits, which include personal and professional growth. This will lead to the nurse being more educated and more prepared for future patients. There are also health outcome variables that are affected when culturally competent care is provided. There is an improvement in the quality of nursing performance, a higher chance that the treatment will be effective, and the treatment is then also cost effective. And so where do homeless clients come from? So clients experiencing homelessness come from many different backgrounds. They could have grown up with dysfunctional families, maybe facing some sort of unemployment, poverty, and they may lack affordable housing. Oftentimes, clients experiencing homelessness also struggle with substance abuse and mental illness. Some common exposure issues that may cause a client experiencing homelessness to seek healthcare are exposure injuries, malnutrition, and issues with substance abuse. These clients experiencing homelessness are often brought to the hospital via ambulance, will have multiple hospital visits, and are also likely uninsured. So, what are the effects of homelessness? There are many different effects of homelessness. Patients experiencing homelessness often are malnourished, do not have access to dental care, and often experience a great deal of violence. People experiencing homelessness also suffer from limited social and educational opportunities. Therefore, they often have poor self image due to not living within the quote unquote societal standard. Oftentimes, people experiencing homelessness drop out of school, which can lead to a higher chance of facing the decision between committing a crime that will help them stay alive or possibly facing death. So, culturally competent care to the homeless client. So, providing culturally competent care to a homeless client first starts with fully understanding the situation and the needs of the client. The nurse needs to first break down the barriers that are preventing a transparent relationship between the client and nurse to provide the most effective care needed. Um, the nurse must provide cross-cultural communication where the nurse will use effective communication skills with the clients that will take into consideration the client's verbal and nonverbal cues, cultural values, context, and unique healthcare needs. The nurse will use a cross-cultural practice method. This is when a nurse utilizes cross-cultural knowledge and culturally sensitive skills in implementing culturally congruent nursing care. And to implement the most effective care, the nurse must provide the structure and resources necessary to evaluate and meet the cultural needs of their diverse clients. The nurse also needs to understand how to be an advocate for the patient and recognize the cues or recognize the resources available for their patient and advocate for the inclusion of their patient's cultural beliefs and practices in all dimensions of healthcare. So, culturally relative and sensitive care necessary for the homeless client. So, when taking care of a patient, it is important to be respectful and understanding towards their background and lifestyle. Homeless clients also should be treated with the same respect as any other patient that is admitted to the hospital. When providing sensitive and relative nursing care, nurses should be willing to be respectful and flexible towards the patient's needs when providing care so that it matches the cultural aspect of the patient. Be treating patients like adults, no matter their situation. Addressing people with any medical issues or disabilities with the name they prefer can help promote respect towards the patient. Nurses should also be aware of the sensitive factors that act towards the situation the patient is currently experiencing. Having knowledge of the patient's problem or disability can help build the patient's attitude and relationship with their healthcare provider. Nurses must also be listening at all times and actively participating in any conversations the patient may want to have. Having proper posture and knowing when to speak or listen is a positive characteristic to help create a good relationship with this patient. So, some medical resources for the homeless. So, some examples of resources for people experiencing homelessness are the Medical Respite Program, Psychosocial Recovery and Rehabilitation Center, also called the PRRC, and Social Skills Training. So the Medical Respite Program provides healthcare for the homeless. This is a place where people experiencing homeless can recover, receive clinical services, and receive mental health support. The Medical Respite Program is made up of 25 beds and is dormitory style. So this may be difficult for some people to handle, but the Medical Respite Program works with other agencies to help support people that may need extra comfort and mental health support. The PRRC assists with teaching individuals life skills, money management, how to prepare food, and medication organization. And social skills training helps people experiencing homelessness establish and maintain interpersonal relationships for both peer and family relationships. The PRRC also assists with finding employment and maintaining employment. So, what are some barriers of applying culturally competent care to homeless clients? So, clients who are homeless usually are not financially stable and able to afford the basic qualities needed to survive. Insurance and healthcare can be expensive, especially in the United States. Homeless clients may not have adequate means of transportation, which may also fall under financial stability. Cars are an additional expense that the homeless client may not be able to afford. No resources such as computer access and the education on where to go for government assistance is an issue. This can also be altered by homeless clients who have language barriers and don't fluently speak English. This will cause a setback to receiving quality care. There's also the aspect where there is embarrassment for homeless clients to receive help due to their physical appearance or hygiene. It may draw them back from seeking and receiving help. Many others may judge homeless clients, which also puts the psychological strain on the client and cause them to not receive the help they need. The pride of a client could also stop them from asking for help to receive competent care, and distrust in others or the healthcare system, maybe from a cultural or spiritual belief, which can be a blockage to competent care from the homeless client. So there are many factors that are associated with homelessness: access to healthcare and health insurance, socioeconomical status, income or lack of income, and education. Oftentimes, people experiencing homelessness do not receive a proper education due to lack of access, interest, or even lack of support. This typically leads to dropping out of school, which hinders one's ability to be employed. So clients experiencing homelessness struggle with receiving proper health care because many do not have access to quality health care within their communities. Clients experiencing homelessness also have a higher mortality and morbidity rate due to lack of shelter, food, medication, or safety. So, what are some roles of the RN when caring for a client who is experiencing homelessness? So, the RN must assess the patient's health and background, consider certain health conditions that many homeless clients face, provide patient-centered care, assist patients with getting patient back to their optimal form of wellness and health, assist patients with assembling a plan for their lifestyle after discharge, and help patients find free services that are meant to help underprivileged populations. So some common health issues found within the homeless population are liver cirrhosis, respiratory disease, diabetes, hepatitis C, substance abuse disorders, mental illness. And why is a post-discharge plan important? So assembling a post-discharge plan for patients experiencing homelessness is important for many reasons. Most of the time, people who are experiencing homelessness do not have access to resources that will help them find proper primary or preventative care. A post-discharge plan can also help a patient have a path to follow that will help them continue to stay healthy. And by providing structure, these patients will be able to advocate for themselves, and this could prevent the number of readmissions to the hospital. And so, again, some more services that can help the patients after discharge. Community health centers are government-funded centers that are meant for improving health amongst populations in the community that do not have the proper support and resources to access a private primary care physician. These centers often provide family care, physicals, TB testing for STDs and STIs, substance abuse treatment, mental health treatment, prenatal care, and so on. So that is the presentation on caring for a client experiencing homelessness. Please leave any questions, and thank you so much for watching.